Hello everyone, I am Sumitra from Department of Radiography and Imaging Technology at SNS College of Allied Health Science. Today I am talking about the topic of angiography. Introduction. Angiography is a radiological examination of the coronary arteries in which contrast medium is injected into the heart's blood vessels through the catheter to identify the narrowing blockages, functions, heart disease and coronary artery disease. As the contrast medium travels through the blood flow and the radiographers are taken. Anatomy. The coronary arteries rises from the aortic sinus. They transport blood into cardiac muscles. There are two main coronary arteries, the left coronary artery and the right coronary arteries. Indications of angiography. Blockage in coronary vessels, aneurysm, anteriovenous malformation, atherosclerosis, stenosis, suspected of clot, thrombosis and embolus, chest pain, congenital heart disease, heart valve disease, vascularity assessment of a tumor, investigating source of hemorrhage. Contraindication for angiography: allergy to iodine contrast, renal failure, hepatic failure, suspected pregnancy, severe anemia, impaired blood clotting factor, recent stroke, absence of pulse at the access site, severe hypertension. Pre-procedure investigations. The pre-procedure investigations must be reviewed by the radiologist or cardiologist, which includes chest X-ray report, blood urea, blood serum creatinine, ultrasonography report, and CT MRI reports, liver function test reports, blood sugar reports, total blood count and bleeding and clotting time. History of previous medicines, bleeding disorder should be taken by the radiologist. Patient preparation. The patient is asked to take low residue diet for the 2 days prior to the examination and drink clear liquids the day before examination. Fasting may be employed for 6 to 8 hours. Ask the patient not to eat or drink after midnight. Women should inform about any possibility of pregnancy. Pregnancy women should not have radiologic examination because of the risk of radiation exposure to the unborn baby. The patient is instructed to remove all the metallic objects and metallic jewelry from the body. The patient is asked to stop taking an anticoagulant 2 days prior for the examinations. The puncture site must be shaved before the examination. The patient should be hydrated before examination and pre-medicines are given to reduce anxiety. Equipment. The major cath lab equipment are the same, but additional specific equipment are required for the coronary angiography. JR4, Judkins right 4 for right coronary artery, Judkins left 4 for left coronary arteries, digital catheter for ventricles, sheath, guide wire, contrast agent, iodine, non-ionic water soluble contrast media. Local anesthesia procedure. On the day of the examination, the technology should describe the whole procedure to patient and obtain written consent for the patient for permission of the procedure. The patient is caused to remove clothing and wear hospital gown. The patient is placed in the supine position with an empty bladder on the fluoroscopic table. An intravenous line is inserted into the patient arm. If necessary, sedative medicine is given through the line to make the patient relax. The blood pressure, heart rate, respiration rate, oxygen level, and other vital signs of the patient should be monitored during the procedure. Then antibiotics and necessary medicines are given to the patient through an IV line prior to the procedure. The safety traps fastened on the patient body to make him embolize, and pulse oximeter is clipped on the patient finger for the measurement of oxygen level. The puncture site of the patient must be cleaned with the antiseptic solution under the sterile rectal and dropped with the sterile towel. The most of the fold instruction site of the guide drawing area. Afterward, local anesthesia is given at the inside sites. After numbing the area, the cardiologist applies the Seldinger technique to access the femoral artery. In Seldinger technique, a vascular access needle is inserted on a specific angle direct into femoral artery. When the blood comes out from a needle, then a flexible small guide wire is inserted through a needle. After insertion of the guide wire, the needle is removed and then sheath is placed over the guide wire. After placing the sheath is femoral artery, the guide wire is removed. Guide wire is removed. After that, a catheter with a wide wire is introduced through the sheath. The movement of the catheter is monitored by cardiologist and radiologist under the fluoroscopy. Then cardiologist gently advance the catheter into abdominal aorta through the common iliac artery and slightly insert into the aortic sinus, passing through the aorta. After placement of the catheter in the desired position, then the iodinated contrast medium is injected through the pressure injector to the coronary vessels under the fluoroscopic guidance of the CM machines. During the administration of the contrast medium, the patient is asked to hold his breath. The CM machine moves under the patient, around the patient's chest, and it takes image of the aorta and coronary vessels. The radiologist and cardiologist evaluate the blockage, listen, structures, and other abnormalities under the CM fluoroscopy. The fluoroscopic system and video recording system of the CM machine gives real-time image of the aorta and coronary vessels. During the examination, if PALQ is present in coronary vessels, the cardiologist may be performed balloon angioplasty or stent placement is coronary vessel. After completion of the procedure, the sheath and a catheter will be removed and then puncture site is closed by pressure dressing. Complications for angiography. Allergic reaction to the dye, blood clots formation, infection in vessels, injury in the aorta, tear in the aortic wall, closed pulpix sometimes cause the stroke, internal bleeding due to the damage to the artery wall. Aftercare. The patient should be kept under observation. The blood pressure, heart rate, oxygen level, fluid balance, and other vital signs must be monitored. The plenty of liquids are given to the patient to prevent dehydration and blushing contrast media out of the body. If the vital signs are more normal, then the patient is allowed to leave the examination. Now I am ending my topic. Thank you.